Hello again. The dust is still swirling as the political parties try to make sense of an election which put Tony Blair back into Downing Street for a record third term, but with a sharply reduced majority. And a result which gave Michael Howard a few more seats but leaves the Tories light years behind Labour. And with both men in different ways on the way out, their parties now face the prospect of sharp and divisive debate about the best way to chart their way into the future. So today we have a Blairite cabinet minister, as it were, on the make, Patricia Hewitt, and two Conservative politicians, John Bercow and John Redwood, from opposite ends of the divided Tory spectrum. First, though, the Health Secretary, Patricia Hewitt. As I suggested, you had a historic victory, but with only 1 in 5 of the electorate voting for you, it's hardly a resounding vote of confidence, is it?
Even 5 years ago, certainly 10 years ago, nobody thought we were going to be returned for a third term with a majority which, when we were in opposition, frankly, we would have died for.
In seats, but not in terms of the popular support.
No, in terms of the popular vote, I think there's no doubt at all. We've seen turnout going down, and although we managed to edge it back up in this election, it is still nowhere near the levels that were taken for granted in the 60s, the 70s and the early 80s.
So you're quite content to have office with only a third, 36% of those who voted supporting you and the rest opposing?
No, Jonathan, don't misunderstand what I'm saying at all. I am delighted, as all of us are, that we have been re-elected for a third term with a commanding majority. But I am very concerned, and most of my colleagues are, about the fact that the people's engagement with politics and the parliamentary process has gone down. And that, of course, is reflected in the fact that we have been elected on the basis of really a very small share of the total population. So I think one of the challenges for us in this third term is how we re-engage people and rebuild that engagement and confidence with parliamentary politics.
Okay. You've all made much of listening, going to listen a great deal. Are you going to listen to voters who say that the electoral system, which gave you your victory in the way in which it did, and as you say, on a declining share of the vote, is very unjust and out of date?
I've always been in favour of electoral reform, and indeed, I think it must have been in our first term, I was involved with a group of members of Parliament, and we were putting forward proposals for a voting system that would have kept the constituency link, which I think is an enormously important and strong part of the British Constitution, but nonetheless would have made the system much more proportionate. I continue to think that that's the best way forward, but I'm a realist, Jonathan, and the truth is there is not much agreement on the way forward in terms of the election system.
You have got cabinet colleagues who share your view. They don't necessarily express it quite so unambiguously. Aren't you inclined to use this situation to say to the Prime Minister, look, you talked about giving a referendum on electoral reform. Now is the right time, the honourable time, to deliver that referendum, that representation of the people which is fairer and juster?
There are very, very different views on this, right across the Parliamentary Labour Party and indeed inside the Cabinet. So I don't think it's a matter on which there is any immediate consensus.
Should it be a matter of debate?
I think it should myself, but there are even more or far more urgent things to do. And I would come back to the core issues on which we have just been elected for a third term.
Okay, which we will do. Good. But just one more thing on this. The statistics. I mean, these are the statistics that you ought to be, if I can put it like this, given your perspective, deploying that in England, the Conservatives had more votes than the Labour Party by some 60,000. But the Labour Party got 92 more seats than the Conservatives. I mean, that is, for anyone who wants to have a system that will engage people, is grotesque, isn't it?
Well, that is the way that first past the post works.
But do you share my proposal to you, that like Neil Kinnock, your great friend Neil Kinnock, who says it's indefensible? Do you regard it yourself as indefensible? Or are you prepared to just go on saying, well, I'd like a change? So
I'm critical of that system. And I think it would help. I don't think it would cure the problem of public disengagement, but I think it would help if we had a more proportionate system where you weren't, as it were, piling up huge majorities in some seats, whether those are Conservative or Labour, but getting a real disparity between the overall votes and the overall seats. But in order to make a change, you first have to build some consensus around what the alternative ought to be.
And that means
and there are
debate.
Criticisms to be made of any voting system. And of course, the more proportionate you try to make it, the more complicated it tends to become. And as you know, I was born and brought up in Australia, where they have some beautifully proportionate voting systems. They are so complicated, it takes weeks to find out who's actually been elected.
Listening to people, Iraq obviously was a major component of the result. Votes that hemorrhaged away from Labour, principally to the Liberal Democrats. Do you share the view expressed by Gordon Brown and Stephen Byers that if there is ever to be war again, military action, MPs should always be given the vote on that?
I do agree with that. And of course, we had a parliamentary vote before we went into Iraq.
So that should be a precedent.
And I think it should be a precedent. And indeed, I think by doing it on this occasion, we effectively made it a precedent. We said that was the right thing to do.
If you were also listening, would you not conclude that it was Gordon Brown what won it for you, despite Tony Blair, and that therefore Tony Blair should heed the voices of those who say that he should go sooner rather than later?
I don't accept either of those propositions. I think we won it as a team. We won it in particular because of both Tony Blair and Gordon Brown. And I completely fail to understand when we've just won a third term with a commanding majority, when the Tories have won fewer seats even than we won in 1983, and when the Liberal Democrats aren't going anywhere, that a handful of my colleagues have decided to act as though we'd lost the election rather than won it, and try to create a wholly unnecessary leadership crisis and leadership debate.
So what do you make of Robin Cook, who says that Tony Blair is essentially stubbornly deaf to the central message of the electoral campaign, that he's unable to rebuild the trust he lost over Iraq?
I think he's wrong. And I think he's wrong because this was a very complex and fragmented election. There were different things going on in different kinds of constituencies. You'll find, for instance, in many constituencies that actually our majority went up. I mean, I spent part of the very last day of the election campaign down in Dorset South, our most marginal seat. Now, Jim Knight was returned there with an increased majority. There are other colleagues, including the Prime Minister, who had an increased majority. And then there are some, including, let me say, Claire Short, where there was a very big swing against her.
So you take the view that this was from the British election a valedictory salute to the Prime Minister. We love you and we want to go whenever you feel it's necessary.
I was making the point that
you obviously don't think that. You obviously don't think that.
Different people were voting in different ways for different reasons. Iraq was a very important issue. And for a minority, but I suspect quite a sizable minority, it was the number one issue. There were other people who were perhaps disappointed with the pace of reform and actually transforming the public services. There were others who were voting Labour, in some cases for the first time, because of what we'd done to help their families with tax credits and such like.
A couple of big issues that are now on the agenda. One of them has been for some time. ID cards. A majority of the voters supported parties that explicitly are opposed to ID cards. Significant proportions of your own backbenches are opposed to ID cards, but you are going to press ahead regardless.
We've just been elected on a manifesto, the most detailed manifesto I think that we've ever been elected on, and that includes the commitment to legislate for ID cards, and people
you'll force it through, come what may.
People voted for us in the full knowledge that that was part of our manifesto. And let me say, ID cards have always, according to the opinion surveys, commanded majority public support.
You can't have both ways. You can't say, as you frequently do, it's the poll on the night that counts, and inside opinion polls, which you reject in that context, as confirming that you can go ahead and do what you want.
I'm simply making that point. But we were elected on a manifesto. It includes identity cards. And yes, we will go ahead with that bill.
Nuclear energy, about which there was not much discussion by cabinet ministers before the election. They tended not to want to talk about it. Is it the case that within the next year or so you have to make a decision about that? And if you do, and it's in favour of nuclear energy in order to combat climate change, you will then press ahead.
Where we were, you remember I did a white paper on energy, put in place a new energy policy in January 2003. And we said then we needed to keep the nuclear option open, but we had to give priority to energy efficiency and to renewables. Because if we'd said then, oh, we're going to do nuclear, then everyone would frankly have forgotten about both renewables and energy efficiency. Now, of course, that's got to be looked at again to see how well we are doing, not only on renewables, where we're definitely on track for the 10% target, but also on energy efficiency.
And it's a matter of urgency?
Well, we've got a climate change review underway. That'll be published a little bit later on this year. There is a real risk, I think, because the economy has been growing so strongly, that we may not meet, our Kyoto targets are fine, but we may not meet the much bigger domestic targets that we've set ourselves over and above Kyoto. And that'll be the context for looking at, do we need nuclear power? And if we do decide that we need a debate around that, then we'll come forward with a new white paper specifically on the nuclear power question.
And that could be, what, a year out from now?
When I looked at this issue for the Energy White Paper, I was astonished to find that it would take 15, 18 years to get a new nuclear power station up and running, not because they take that long to build, but because you take about 10 years to do the planning. We've already shortened the planning system by streamlining it, so actually the decision, it gives you more leeway in exactly when you could make that decision.
But it has to be sooner rather than later, obviously.
Well, you know, the share of nuclear power in the total energy mix starts going down from about 2015.
But it has to be inside this Parliament.
I would think so, yes.
Let me move on to your new responsibility, health. You've clearly signalled that you're picking up with relish the baton that's been passed on to you. What is so wrong with an NHS that you have to use taxpayers' money to finance private sector providers to deliver operations that could otherwise be done by NHS surgeons?
The NHS is magnificent. It is one of the best loved institutions in the world, and I think the reason for that is that it is founded upon this incredibly important principle that treatment should be based on clinical need and free at the point of care, not based on your ability to pay. But the NHS, even after the investment and the changes we've been making, and even given the incredible dedication of the staff, it still isn't good enough for what all of us as patients want.
You mean the private sector can do it better?
No, we're bringing the private sector in where we need them, both to give us more capacity and get those waiting lists down, but also to give us even more innovation than we've already got.
Why can't the NHS provide the innovation?
Well, you're getting innovation in the NHS, but you're also getting it from the private sector.
But why can't you just buy it into the NHS?
No, because look, if I take the example of cataract operations, people used to have to wait 15 months or more for that, and they're mainly elderly patients. It's a long time to have to wait.
But why can't you put the money into the NHS, the new money, rather than outside? For that, you're putting 3 million outside to do, 1.7 million new operations over the next 3 years or so, 5 years or so.
Years.
Why can't you put that money, and many health professionals ask this question, into the NHS, the new facilities there, and buy the skills inside the NHS, inside that wonderful institution that you spoke about at the very beginning?
We're doing that as well.
But why not do it with this? Why do
Jonathan,
it outside?
Let me explain. We're putting more money into the NHS than ever before. We've got more patients being treated in NHS hospitals, more doctors, more nurses, you know the list. We've got all of that. But if we had only tried to build up the capacity inside the NHS, it would have taken too long. And that's why I give you the example.
Why does it take longer to say, right, we have to have this new unit built and we have to staff it inside the NHS than outside the NHS?
Because by bringing in new providers, they are bringing to us new ideas about how you can deliver healthcare, as well as professionals, new professionals.
And you can't hire them as consultants and say, thanks for the great idea, we'll use it. You have to say to them, okay, we will pay you for this, you can be the provider and you can make the profit out of your idea.
What we're doing by bringing in the private sector, we are using private sector capacity that already existed. That's why we've got those hip replacement waits down so long. But we're also creating new things like these mobile walk-in cataract surgery units. They've never existed within the NHS before. They've now been created in Britain, and they've brought the waiting lists down for cataracts to no more than 3 months, 4 years earlier than we thought we could do it. Now, I'm not prepared to say to patients, I'm sorry, we're only going to do this one way, and therefore you've got to wait another 4 years before you can have your cataract really fast. We can do this better and faster by using a small amount of the independent sector and by putting more money and reform than ever before into the NHS itself.
In logic, there's no reason why you shouldn't extend that principle to other areas. Why not to primary care, for instance?
We're already seeing a lot of innovation in private care. The walk-in centres, for instance. NHS walk-in centres, but maybe some provided by the independent sector as well. Now that's fantastic, because indeed I visited one just last Tuesday.
And you don't mind the extension of that, according to exactly the same principles, into the private sector, if they can come up with good, innovative ways of treating patients in primary care?
The central issue here is what is going to work for patients.
So that's a yes?
And what, no.
It's a yes, you don't mind?
It's a qualified yes, because we're going later this year to have a white paper on the whole issue of primary care and unscheduled care. And clearly things like walk-in centres, and we're opening more of them later this year, are giving people, including those who aren't even registered with a GP, much more choice about how they get care from GPs and nurses, and being able to walk in somewhere basically any time from 7 in the morning till about 6 at night, any day of the week, any week of the year. That's a terrific innovation,
and
which
no reason
we've
why it
not
shouldn't be
had
done.
in our traditional GP
right,
services.
And there's no reason why that shouldn't be done by the private sector, so long as it's free at the point of need.
The important principle, free at the point of need, and then let's look at what patients need and how do we best deliver that.
We're very nearly at the end of our time, I'm afraid. MRSA and hospital-acquired infections. You've made it very clear that you are appalled by the situation. Is it true that you need to take action to make sure that family members, visitors, go into those hospitals as if they were going into, say, a food processing plant where they'd have to wear nets, uniforms, gloves in order to make sure that the disease doesn't spread?
It's not as drastic as that. And look, our best hospitals have already got this pretty much under control. Guy's and St Thomas's, which used to have a bad rate because they're doing such difficult operations, halved their MRSA rate within 12 months.
So what do you want to happen?
First of all, we need a much stronger legal framework, and we'll be consulting on that in a couple of months' time.
What does that
later
mean?
On this summer.
It means that they would be liable, if someone got a hospital-acquired infection, they would be criminally liable?
Well, that's what we're looking at. But tougher standards, because we can't have a situation where we've got tougher hygiene laws and standards in food factories than we have for people who are very, very seriously in hospital. And of course I'm not going to suggest that everybody going into a routine ward for a routine visit has to be gloved and masked and everything else. That would be absurd. But all of us as visitors do have a responsibility here. And I was quite shocked when I was visiting a Leicester hospital with good infection control last week to hear the cleaner saying, there's antiseptic gel on every bed, there are signs up saying, please wash your hands. Visitors walk straight past them, and even some of them get very cross when a nurse says, please, would you use this stuff? We're trying to control infections. We've all got a responsibility here.
So, very briefly, in a phrase, you've got to toughen up, and you will toughen up.
Yes.
Secretary of State, thank you very much for talking to us.
Election as leader of our party. I believe it's better for me to stand aside sooner rather than later.
After their third defeat in a row, the Tories are licking their wounds and wondering about the way ahead. They face the task now of electing a new leader to guide them towards what they hope will be the sunlit uplands of the next election, a political beauty contest which is sure to reflect the deep divisions within the party. And I've been exploring those with two senior Conservatives from opposite ends of the spectrum, John Redwood and first John Bercow. John Bercow, you've been given a good kicking by your leader for using the word repellent in relation to the campaign on immigration. Do you feel duly chastened?
The leader has spoken. That has to be respected. I was reflecting what had been said to me in my own constituency. Immigration is an important issue. We certainly have to have a policy on it. I think it's very important that the party should broaden, that we should have a wide range of policies, and that we should have a broad view of Britain.
So you're not exactly saying sorry?
The leader has spoken, and I respect that.
You also were very critical of the use in the campaign by the leader of the word liar in relation to Tony Blair. Do you have any regret about that?
I've always myself felt that the Prime Minister exhibits an extreme tendency to exaggerate arguments in his favour and to play down, ignore, or even rubbish the arguments against him. Each of us must choose his or her own language. I do not accuse the Prime Minister of being a liar. The party took the course that it took. I don't think there's a lot of point in raking over the coals endlessly. We have another 33 Conservatives in the House of Commons. We increased our share of the vote by 0.5%. If we're to get into government next time with a working majority, we need to win something like 140 seats next time. So there's a great deal of work to do, as I think colleagues throughout the Conservative Party are united in recognising.
It's a mountain to climb, in effect, isn't it?
There's a hell of a lot of work to do to extend our base, to build upon our support. And my guiding principle, for what it is worth, is that in the months and years ahead, we need to spend a lot less time listening to what is thought by those who already vote Conservative, and a lot more time listening to what is thought by those who do not currently vote Conservative, but whom we need to attract if we are to return to office.
How do you yourself describe the best way to proceed, the best way of attracting new voters?
As far as I'm concerned, there are a number of steps the Conservative Party can and needs to take. First, over a period, we need to set out a positive Tory vision of economic efficiency and social justice. What we have to show is how we can contribute to the nation's wealth, make the country prosperous, and at the same time extend opportunity throughout society. So opportunity and social justice must go hand in hand, and they should be part of a revitalised Conservative approach.
Right, but then look at the opportunity and economic efficiency. David Davis, obviously a serious contender for the throne, says we've got to define ourselves as the low tax party. Where does that get you?
I think that Conservatives do favour lower taxes. It's very much part of our creed.
So when
but
John
lower
Redwood...
taxes are not an absolute. They're not what is required in every circumstance.
Understood, they're not an absolute, but when John...
That they're affordable and that they're the right policy in the circumstances.
When John Redwood says of the 4 million tax cuts that were being proposed in the campaign, that's just the down payment, does that not send the message that will attract new voters?
I think we have to be very careful about it. Obviously, the pursuit of savings is an ongoing process. It isn't a one-off. You can and should continue to look for ways in which you can do things less expensively to cut out the fat. So I don't think that a tax cut is a one-off, a once-for-all, but it is a question of balance and of priorities. And if you were to say to me, would I regard it as a great priority for the Conservative Party to slash huge sums in taxation before considering what that might mean for public services? The answer is no. And what I would say is maintaining and improving public services are just as important objectives for a modern Tory party as the reduction of taxation.
So therefore you shouldn't define yourself and be seen as being different from New Labour in terms of being the low tax party, the clear blue water as it's been called. That is not the way to go.
I think to define the difference between Labour and the Conservatives purely or predominantly in terms of the level of taxation would be a mistake.
OK. In relation to public services, you said, I quote you very recently, we still appear to think that the best way to improve public services is to offer the public an escape route from them. This is the counsel of despair. What are you getting at?
You can, as a government, offer people an opt-out. You can say, if you are willing to pay for a proportion of the cost of your operation in the private sector, we, the state, will pay the other part of it. We can say, if you're unhappy that your child is in a poor public sector sink school, we will try to subsidise you to send your child to a private school. Jonathan, you can do that as a government only for a minority of citizens, only a minority of patients and a minority of pupils.
And so your solution to that would be ditch patient passports, ditch school vouchers.
We're not yet at the stage of formulating detailed policies of election. We've only just lost an election. My view is that the first priority is to look at the way in which you can improve the delivery of quality services to the majority within the public sector. So for me, it certainly wouldn't be a priority to think in terms of the use of subsidies to people to go private.
Do you believe that the Conservative Party, to use that memorable phrase of Theresa May's, is still seen as, in this context, as it were, quotes, the nasty party?
I think that we still have an image problem, and what I would say is we've got to aspire to be a party that is capable of representing young and old, male and female, black and white, north and south, rich and poor, public sector and private, married and single, straight and gay. We've got to be in favour of people, not a party that is in any way seen as preaching to people or judgmental about the way in which people live their lives.
You sound very much like someone who would endorse Tim Yo's view that this election has to be won on the centre ground. That's a quick yes or no. It's a yes to that.
Yes, I'm in favour of an appeal to the centre ground. It's an indispensable prerequisite.
That means, given the shift in the Labour Party, which occupies the centre ground, that you're going to be dancing with them on the same pinheads to get new votes, rather than striking out to one side and saying we must be clearly, demonstrably, ideologically different.
Yes, my attitude is this. The Conservative Party, at its best, for most of its history, to the centre ground. For the best part of 15 to 20 years, the Labour Party lurched a long way to the left. Now the Labour Party has come very much to the centre and seized our territory. We have to consider our response. Do we think, oh, well, this is very unfortunate, the Labour Party is occupying our house, it's squatting in it, so we'll go and buy a house somewhere else? Or do we say, as I do, no, what we must do is get rid of the squatter. We have to re-inhabit the centre ground, and the squatter party, the Labour Party, must be removed from our property.
At the other end of the spectrum, John Redwood, a member of the Shadow Cabinet and a leadership contender in the past, now keen to talk about the way ahead for his party.
I think Michael Howard put together a very strong and energetic campaign in the few months he had as leader, and he certainly made an impact, and we won some seats under his leadership, which is good news. I think now we need to broaden it out. We attracted some new voters, but not nearly enough to win a general election outright. Our task for the next 4 or 5 years must be to attract those additional voters. To do that, I think we need other themes and other ideas.
Just on the campaign itself, some of your colleagues, John Bercow, for example, have said that parts of the immigration issue were repellent, or that it was wrong to call Tony Blair a liar, or were you at ease with that?
I wasn't at ease with the television election in the round, but I don't blame Michael Howard. I think it was the media which narrowed the focus and tried to make more extreme statements out of what was being discussed to make it more interesting.
But he made all his speeches on the thing. He kept going back to it again and again, didn't he?
He didn't make all his speeches on it. I mean, he was running 5 different subjects that the media kept on coming back to immigration. As a result, a lot of my electors were saying to me, we know where the parties stand on immigration. In many cases, they didn't think that was the most important issue for them. And can we please hear about something else? So I was dashing around where I was campaigning, trying to set out lots of other ideas which simply weren't coming through. I would characterise it that I think we had a tabloid election, but there are a lot of broadsheet readers out there who felt very let down by the election as it came across.
In order to achieve the sort of momentum that would make it possible for you to win the next election, does the party have to redefine itself or simply reassert itself, or something else?
Well, I think the party has to modernise in the best sense. That's become a partisan term, and I think that's a pity, because I think all sensible Conservatives want to move the agenda on so that we are discussing the things that matter to modern electors.
You are on record before you went to the shadow cabinet as urging more boldness in delivering tax cuts. The $4 billion that was on offer you've described as a down payment. Do you believe that if you go back to the electorate and say, here are bigger tax cuts, you would attract the kind of votes that would make you a real player again?
I think it is quite likely that come the next election we will want to be offering more by way of tax reduction than we were able to in the last one. What I meant by down payment was that the $4 billion of tax cuts we could offer, compared with today's tax rates and tax impositions, was actually part of a much bigger sum of money, $12 billion. But we felt that we had to say $8 billion was there to avoid Labour's third-term tax increases. We're now going to find out whether we are right. I fear we are going to be right. I think Labour is going to put taxes up more. That means that if you just simply carry our policy forward to the next election, it will be $12 billion of tax cuts, because Labour will have put in the $8 billion, and we will be able to find ways of reducing that by finding unnecessary expenditure. But we can't come up with figures yet today, because it depends how much Labour spends and how much they change their own plans.
Did you meet on the doorstep people saying, we would like tax cuts, please, Mr. Redwood, and your party's only offering them at the margins?
Yes, I found on the doorsteps there was a lot of sympathy for the consultation documents which we'd put out earlier, before the election, saying that we thought elements of inheritance tax and elements of stamp duty were very unfair taxes. And there was a feeling in some areas that, well, you haven't gone far enough. You correctly said these taxes are unfair, but when you came to do your sums, you discovered you couldn't do very much. There was a big feeling about stamp duty in my part of the world, because whilst it was very welcome that people could be free of stamp duty up to $250,000, helping those buying the starter home, it still left people trading semi-detached or detached homes, slightly bigger homes, paying very large sums of money just to move. And sometimes people had to move for a perfectly good reason, and they didn't have that huge sum of extra money to give to the Chancellor.
So would you, in principle, go for the kind of tax cuts that will have an impact on people on earnings, on middle-class earnings?
I think we must be the lower tax party. I can't tell you today how big that can be. We don't want to shortchange the schools and the hospitals and the police force, but it may well be possible to offer something really quite generous, whilst making sure that we have all the teachers, nurses and policemen we need, over and above the current levels of recruitment which we see today. So yes, I'm sure we would be looking for that, and I don't think that is as divisive within the party as people like to make out.
I want to move on to the territory of public services, particular health and education. In this context, do you believe that going to the electorate saying we will have, in shorthand, patients' passports and school vouchers attracts votes or repels them?
Well, I don't like that language that you just used. I think if you say to electors, you can have much more choice of school for your children, and that will be a real choice, and there won't be an artificial boundary between an independent school and a state-supported school, that can be very attractive indeed.
What does that mean?
Well, I don't like this them and us world where some people have rich parents and so they can go to an independent school which is seen to be very smart by others, and the rest go to a state school. I think it'd be much better if the head teachers and boards of governors of schools that are entirely paid for out of taxation had similar powers to hire and fire, shape the school, influence the curriculum, control discipline, to those which you have in independent schools.
And by the same token, do you want to live in the world where patients can choose to be entirely in the private sector, paid for in part, as was on offer, paid for in part by the government if they had a bit extra money to pay for themselves?
Yes, and I think the offering which we made at the last election, which got ignored because of the part payment issue, was that we were also saying that, of course, they can go to an independent hospital or to an independent surgery for treatment if it costs the same as the NHS average provision, and that got missed out in the debate, but we were well advanced in our thinking on that subject.
I want to come back to that.
And of course Labour is now moving in that direction with their idea of private treatment centres being added on to the NHS, which I'm quite happy about. It's interesting how much strife it's causing them.
Do you believe that there has to be, in that phrase, clear blue water between Labour, which operates on the centre ground, and a Conservative party that has to win back new voters?
I'm not very keen on the phrase clear blue water, and I certainly don't think I believe in the centre ground in the way it's been traditionally defined. I think the audience, the electorate, is far more diverse and canny than that suggests, and I don't think there is a single set of propositions which are the centre ground which Labour has occupied.
So when you have the likes of Tim Yeo saying we have to win on the centre ground, that's slightly, from your perspective, missing the central argument.
Well, I don't want to criticise Tim, and I think I can understand what he means. I would put it a different way. In my language, I would say that a political party is a coalition of the willing, and the art is to build your coalition so that it becomes a coalition of the winning.
What kind of leader is required to build that coalition and then to deliver the possibility of victory?
Well, that's a question for a later day, but the easy answer is a popular person who can pull together all the different strands of the coalition that you need. He or she has got to be someone who doesn't make big enemies of different groups within the party, but someone who has a distinctive agenda that can reach out to wider communities out there that we need.
Now, William Hague has ruled himself out of whatever process it is. You haven't ruled yourself out, from which I can draw the conclusion fairly, I think, that you haven't necessarily ruled yourself in, but you definitely haven't ruled yourself out.
Well, I've said exactly what I want to say, which is that I'm not thinking about who should be leader at the moment. I don't know who I'm going to support. I think it's very important to have a considered debate at the moment on how we choose a leader and a much wider debate on what we can offer.
John Redwood.